My name is Manuel Vogt. I'm an osteopathic family physician for San Antonio Medical Associates, an affiliate of Nix Health. And the affiliation between Nix and Trinity Market is to promote healthy eating habits and to show the benefits of organic nutrition for the population here. So healthy eating is a huge component of healthcare today. We see a lot of problems caused by unhealthy eating habits, such as obesity, diabetes, heart disease, high cholesterol, worsening of arthritis because you're adding extra weight to the joints. So there's a huge impact on just generalized nutrition, and people need to become aware of how healthy eating can really have such a good impact on their health. I get asked that question a lot about how can I start changing my lifestyle to promote better nutrition or have a healthier lifestyle through good choices when I'm going to the supermarket. And I tell people, start off with the realization that you have some unhealthy eating habits. Some you might not realize and some you might realize. And you can kind of go in and start by saying, let's cut down just in moderation. Because I don't think it's wise to just cold turkey cut out, some things like possibly sodas and things like that. Because if that happens, then I find that a lot of patients actually just do it for a short period of time and then revert right back. If you can gradually kind of decrease the, your unhealthy habits and convert them to healthy habits, we find that there's a much better result. So one of the questions that does come up a lot is what is the difference between a DO and MD? And one of the main things is that we kind of view the body as a whole that also has the capability of healing itself. So depending on the scenario, we're not very quick to sometimes prescribe medication. We usually listen to what the patients are asking or telling us, and then we kind of almost try to do some detective work and what's the underlying cause. And from there, we either, we prescribe weight loss or talk about weight loss, healthy eating habits, exercise, and look at, maybe even sleeping habits. It really just depends on the scenario. And there are still going to be certain circumstances where medication is required. And that's one thing to keep in mind, that while we look at you as a whole and what might be happening, stress-related in your life or just in general, we always have the ability to still prescribe medication and at the same time also perform osteopathic manipulation. San Antonio Medical Associates' approach to primary care would be evidence-based preventive medicine, which is actually looking at the evidence that exists currently through research and applying that to our patients and educating them on the opportunities or the treatments that are available to them. And the biggest thing is probably listening to our patients and trying to see, what is actually going on in their lives and how can we help them. There's a few simple things that people can do to really improve their health. One is to just be aware. Just be aware of, the food that you're eating, especially like soft drinks, fast food, different things like that. I would start at the Trinity Market. It's on Saturdays from 9 to 1 at the Trinity University campus off of Hildebrand. They have some great food options, local produce, things like grass-fed, non-genetically modified beef, and I think it'd be a great time. It'd be a nice activity to do with the family. If you see me there, feel free to come up to the SAMA tent, ask me any questions. I'll be happy to answer them.